I guess while we wait the slide to come up, my name is Izzybeth Rodriguez.
My name is Miriam Parra, and today we're going to be talking to you about improving access to reproductive health services for adolescents living in the border region of San Diego County.
The great thing about all this research that's being conducted is that we can do service projects like the one we're going to talk about today. So this map represents San Diego. The red dotted line is where the U.S.-Mexico border is at. When we first started with the idea of a teen clinic, we noticed that there was 13 high schools in the southernmost part of our service area, but represented by the triangles, but the nearest teen clinic or the nearest adolescent-friendly health centers were about 8 miles north. That's not to say that there isn't health centers in our area. There are health centers, but they're more family-oriented. So we wanted to really link these students. And that's when the teen clinic was established, right in the middle of all these high schools.
So what is exactly Teen Clinic? Teen Clinic is a safe space where teens ages 12 to 21 can come in to get free and confidential reproductive health services. Some of the services that we offer include STI testing, condoms, birth control, and pregnancy testing. The reason we are able to provide free services is because we enroll all of our patients in the Family Pact program, which for those of you who do not know, is a government-funded program that pays for these services. In terms of confidentiality, there is the California Minor Consent Law, which allows teens a couple of things. First of all, it allows them to give consent to obtain reproductive health services without the need of parent involvement. Secondly, it allows them to leave school campus if they need to access reproductive health services during school hours. Teen Clinic has also been designed as a parent-free environment, and we do ask the parents of our patients to just kindly wait outside, and this way we protect the confidentiality of our patients in the waiting room. Again, Teen Clinic is very youth-friendly. All the staff is very young. I'm actually the oldest person there. We are all bilingual and bicultural. We do have a female medical provider on site, and of course, we are LGBTQA inclusive. In terms of social media, it has become one of the biggest ways to bring patients into Teen Clinic, but I'll touch upon that in a little bit.
So now that we opened this teen clinic, how exactly are we going to get them in there? So the first thing that we did is we established partnerships with the school districts. We conducted outreach once we were able to go into the schools and physically gave the students flyers. We also participate in school events so that they recognize who we are. And we conduct parent education so that the parents also we help them through that hand-holding process. We're a resource for the school nurses where we provide them school tokens so that if they know of an adolescent who wants to access these services, they can actually give them a token to get to the teen clinic. And we make sure that they're aware of the California laws and that they feel comfortable with them because the students can leave school. We also provide health education where we go into the schools and teach the sex ed curriculum or other health topics. And we provide clinic tours, which has also been very successful in bringing in the students into the teen clinic in order for them to become aware of where it's at in addition to activities. And the last thing that we've done most recently is we've started a peer advocate program where we train teens to conduct health presentations, and they're also a resource for their peers.
So I mentioned social media has become a really important part in bringing patients to Teen Clinic. We use social media in two ways. First of all, to communicate, we use a free texting service called Google Voice. And this way we can communicate with patients. They can text in appointment requests or if they have any questions, or we can contact them if you need to. Secondly, we use to educate. So we use Facebook, Tumblr, Twitter, Instagram, and we just kind of post some images, educational, funny. Here are some of the examples, very bright, to the point, very youth-friendly.
So how have we been doing? This graph represents the number of students teens that have been using the health center since we first started in 2011 until present day. And usually we notice an incline whenever they're on breaks for vacation.
So what have we learned? There are, good things and not so good things. First of all and we were really surprised to find out that clinic tours have been a really good way to bringing patients to Teen Clinic because they come in with their friends. And so they get a feel of how it works. And so if they ever need to come back on their own, they feel more comfortable. And of course, that word of mouth is one of the best ways, to become famous. And most of the patients that come because a friend referred them.
With all these positive things, one of the main challenges has been trying to keep up to trends with all of the social media and finding the staff capacity in order to keep up with these trends. So even though this has been a roller coaster for us, we're excited that we're being able to provide all these services to adolescents in the South Bay region.
you.